Hi, everybody. This is Rita Townsend, and can you believe we're halfway through the month of August? And it's just been crazy, 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 and it may be crazy as I'm getting on as we speak, because I am in Florida with a crazy thunderstorm going on, and I'm so sorry because I wanted to share a beautiful afternoon on the river that absolutely turned into a bad. So I shifted gears very quickly, and I'm inside the house. Hi, Donna. And I'm watching a thunderstorm. So I should be fine because I'm on my cell service, so I should be good. So hi, everybody. Good afternoon. It's Friday afternoon. So another week of journey through a global pandemic and Corona. And there is not a day that goes by that we're not hearing new things and seeing new things. And now we have an incredible incendiary political campaign going on. So that's for another day. So what I want to share with you today is something that I've really been thinking a lot about, because the presence on the internet, we're all doing a lot more of it. I'm judging a lot by my own, but also know that on the replay, when I do these Facebook Lives, I have tons of really of new people and tons of people who are asking questions. So at the end of what I'm sharing today, as always, I'll tell you what my resources are. But we get so many information. And since this thing started, we get conflicting information, or we get new information that really disputes some of the initial information. But throughout, there has been a lot of, I don't want to use the word, out there about things you can do, things you should do, recommendations, blah, 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 that simply are not true. So I have some great information for you today that I'm gonna zip through very quickly, because it's a lot. Some of it you've heard, some of it's ridiculous, and so I'm skipping the ridiculous. But what I really want to do today is share with you some of the things that really are myths. It's kind of like the old school urban legends, things like that get started. And so, but this is very important, because it's really things that could derail or misguide you when it comes to dealing with COVID-19 and the coronavirus and all the lockdown things that we're supposed to be doing. So I'm going to zip through some of these that are correcting myths. So take notes, heads up, open up, and here we go. Okay, first, spraying chlorine or alcohol on your skin will kill viruses. Wrong. It's very harmful. It's designed to work on and disinfect surfaces, not you. Second one, older adults and young people are at risk. Only older adults and young people. Well, we know that's completely wrong now. Coronavirus can infect people of all ages, but we know statistically it is older adults and people with pre-existing conditions. Children cannot contact COVID. Well, we know that's not true. COVID is just like the flu. Well, we know that's not true. It may start with flu-like symptoms such as aches and fever and cough, but it is not at all like the flu beyond that. Here's a good one. Cats and dogs spread coronavirus. And we did hear that early on, and that has absolutely not been shown to be proven at all. They can have a virus that they can come in contact with, and it may actually be detected on an animal, but it cannot be transmitted by an animal. And you have to differentiate here between a real infection and just detecting the presence of a virus. Number 7, I hate to even mention this, face masks always protect against coronavirus. That is not true. We also know that certain kinds of masks have more protection than others. Hand dryers. Have you seen anybody using a hand dryer to kill coronavirus when you're washing your hands? No, it does not kill coronavirus using hand dryers. You have to be with someone for more than 10 minutes to contract the virus. That's a myth. It doesn't have anything to do necessarily with the length of your contact. Rinsing this is one that really bugs me because a lot of people have actually come out with new devices that are advertised to do this. Rinsing your nose with saline protects against coronavirus. There is no evidence to suggest that a saline nose rinse will protect against a respiratory infection. I get so upset when I see these things advertised, and it really is false. Antibiotics kill viruses. We know medically that is simply not true. A thermal scanner can diagnose coronavirus. Now, these thermal scanners are being used everywhere. It doesn't detect anything but an elevated temperature. Garlic, really? Now, that's an old wives' tale. Garlic can prevent the growth of some species of bacteria. That COVID-19 is a virus. It's not going to have anything to do with your virus. Parcels from China can spread coronavirus. There is absolutely no truth in that at all. The survivability of these coronaviruses on surfaces is very, very, very low risk. I'm not sure I mentioned at the outset that this is information that's coming from several different sources, but one I used frequently is Medical News Today, who really gives a lot of updated information almost daily. And it comes from a lot of different sources. And the second one that I'm using today to back this up is Johns Hopkins. So 2 really good resources. Home remedies can cure and protect against COVID-19. No, they cannot. There is no proof that vitamin C or essential oils or silver, sesame oil, sage, there is absolutely no evidence at all that it will protect against COVID. You can catch coronavirus if you happen to touch human waste. No, that is not necessarily the case. This is contracted in a different way. So that is another thing. I had never heard of that. Here's one for us Florida folks. The virus will die off when temperatures rise. Some viruses, like cold and flu viruses, spread more easy in the colder months, but that does not mean that warm weather will stop the spread. That's really kind of under debate right now because we started out thinking that in the warmer climates that would actually help with the spread, and we know that in Florida has not been proven exactly accurate. Any other vaccines like flu and pneumonia vaccines do not protect against COVID. Here's a good one. I haven't heard this. Maybe you have. 5G, which is the new high frequency transmission that we're all going to be using soon on our phones. That the spread of the virus has been connected in regions rolling out 5G mobile technology. This is simply a theory. 5G is not connected with the spread of COVID. And a couple of little last tips that I want to share with you today. Drinking alcohol reduces the risk of infection. That's bad news, friends. It doesn't. Not putting it on your body or drinking it is not going to reduce the risk of infection. Here's one that was going around a lot in our area, which is catching coronavirus in swimming pools. There is no evidence to suggest that it spreads between people through water in swimming pools, hot tubs, or even water playgrounds. Kind of my thought about that was really how we congregate, not necessarily in the water, but around the pool. Here's a really good one. Hadn't heard about this one either. Apparently, there were false documents that were being sold on the internet. I love this. That you can buy a document or a identification card that says you have a medical exemption and you do not have to wear a face mask. Well, that was an enterprising individual, but hopefully you didn't fall for that or even believe that that was impossible, because we know that has been absolutely not true. It's a mandate that maybe comes from your county or your businesses or your state governor, but certainly not any exemptions available. Here's a really good one: laundry. So what do you want to do if you really, really want to disinfect when you come home and you need to wash your clothes? The laundry needs to be a detergent that contains bleach. There's a trade-off with that. Sometimes you can actually ruin your clothes. You should use the hottest or warmest water that you can use, 140 to 194 degrees Fahrenheit. Dry the clothes completely. But it is recommended that unless you're washing your clothes in a detergent that contains bleach, you may not be doing what you think. And lastly, this is a new one, and this is not a myth. This is coming from several sources, and I did kind of do some research on this. The article is coming from the New York Post, but it seems to be the real deal, and it kind of makes sense. We're talking about mask wearing and dental health. This is a thing. Apparently, this is a new thing. Dentists who have reopened their doors are having patients that show up with nasty set of symptoms, which dentists now dub as mask mouth, and can lead to really detrimental effects on your own dental health. So don't cancel your dentist appointment if you're going to the dentist. Don't cancel the appointment. So there's some things I wanted to share with you today. I'm sorry I didn't get to give you the afternoon river view because literally storms just came out of nowhere. But the bottom line is this. As things go forward, we get a lot of information, and we tend to be looking for information, and it's not always valid information. So I always go to the valid resources. Everybody is listening to the CDC, and National Institutes of Health, things like that. But I do Medical News Today, Mayo Health, Harvard Health. They all have great resources, and they're all free. So those are resources that I think would be really good for you to occasionally look at if you have a question. I have a lot of information that is now posted on my YouTube channel. I would encourage you to go to that. And I also do many of those YouTube videos with a doctor who's been practicing medicine for 30 years, and she's doing, because of the kind of practice that she has, which is internal and regenerative medicine, she is doing a lot of research on COVID-19, and she's watching it. She serves on a science advisory board, so she's very on top of things that we find out are really factual and not based in myth and rumor. And that's really what I want you to go away with today. Not the myths and not the rumors. And as much as we'd like to believe some of these things that we're hearing, they're simply not true. And sometimes it doesn't take very much time at all to find out that they really are indeed a myth. And people can really be harmed by experimenting around. So it's Friday afternoon. I hope you're looking forward to a restful weekend, maybe something that's a little diversion from the ongoing pandemic. That's always helpful in terms of your health. Diet, exercise, nutrition, mindfulness, relaxation, social connection, those things haven't changed, and that's what you really need to do as much as you can. Thanks for joining me live, guys. I love it when you join on the replay. Please send some comments and let me know that you're on the replay. A lot of people do get on live and they're silent partners. So you can always message me. So thanks for joining me, guys. Have a great weekend, and I'll see you next time. Bye.